Bismillahirrahmanirrahim. قل أعوذ برب الفلق من شر ما خلق ومن شر غاسق إذا وقب ومن شر النفاثات في العقد ومن شر حاسد إذا حسد صدق الله العظيم. Assalamu alaikum and good afternoon, good evening to all of my dear students according to your time zone. Obviously, we are not in the same time zone. I warmly welcome all of you to this webinar. I am Dr. Aqsa, one of your mentors from the part 1 or from the platform of MedPrep Online. I again warmly welcome to all of you to this insightful webinar, that is how to pass the MRCPCH part 1 in one go. As I have already gone through part 1 and part 2, I have passed this, so I totally understand what are the challenges and difficulties that most of you are facing in this journey. Because I have walked this path, so I am here to be your mentor, your guide, and a source of knowledge to help you. It is a very significant milestone in your journey of becoming a very good pediatric specialist. And obviously, it's a challenging endeavor. So we are here to unravel the secrets to not just passing, but also conquering this exam in just a single attempt. And my goal for today is just not to help you pass. Obviously, anything can any person or any student who is going to be on average hard work, he or she is going to pass that exam. But the core knowledge or core theme is that I have to empower you to achieve the excellence, because you are going to be a pediatric specialist after this exam and you have to be very good at that. Because success in this exam will not to only open your doors to a fulfilling career in your respective country, obviously from any country you belong, but also from all over the world, because it will open the door and the opportunities for you all over the world. So this is very important, and I encourage all of you to actively participate. You can ask questions and engage in the discussion today. So together we can make this journey a very successful, a rewarding and fulfilling experience. And remember, this journey have its challenges, obviously its difficulties. So with the right guidance, right determination, you can pass an exam in one go. I can assure you that you can pass in this exam in one go. So let's just start with it. Once again, I welcome all of you to this webinar, and let's just get started on your path to success. Are you with me? I want any one of you to tell me about what do you mean by success. Obviously, it has different definitions in different parts of phases of your life, but what do you think about it? If you are considering the MRCPCH exam, what do you think about success? Can anyone tell me? Even in the chat, or you can on your mic and tell me about that. No one? And what do you think about success? And what do you think the road to success is that much straight? I don't think so, because every phase and everything, every challenge you are facing in your life, it has its own difficulties and own challenges and obstacles. So it's not that a straight path, obviously. So what it looks like, what people think success is, this is a straight road, but it doesn't happen. This is life, and life is not perfect. So success is what actually it is, what it really looks like. This is what it actually looks like, because it is not a straight path, and Allah has made created life such that you face some difficulties, some challenges, some experience, some obstacle in your life, so that you can learn from it and you can gain knowledge from it and you can utilize it to overcome those challenges, and you can go to your road to success. And why it happens? Because a smooth sea never made a skilled sailor. You know that if your life is perfect, everything is going straightforward, there are no difficulty, no challenge, no one is going to pull you, no one is going to on your back to backbite for you, no one is going to demotivate you, there is no difficulty, there is no challenge, then How can you learn what life is all about? You will be at some point, at some position in your life where you have to guide other people also. Even you are going to be married and you are going to have your kids, so what will you tell them when they are going to face any challenge or any obstacle? Obviously you will have no knowledge how to tackle this situation. So Allah has created our life such that we face such difficulties, such obstacles in our lives, and we learn from that passion, from those difficulties and challenges, that what is our passion, what is anxiety, what is depression, and then how can we fight it, how can we a warrior on this battle. And when in life there is some other person who is going through that phase, it may be your kid, it may be your brother, sister, or it may be your student, and when you are going to be in such a position, so that you can tell them and you can guide them like what it's feel like and how to conquer it. And that is what I am going to tell you. What could be the obstacles in your journey to the MRCPCH part 1? The first and the foremost important thing is your mindset. Sorry for that. Second thing is preparation. There could be stress. And the one thing is that you don't want to come out of your comfort zone. You are doubting yourself, or you are so much ignorant to consider your mistake or your anything about you. Like you are self-doubting yourself and you are not aware of that. You are not coming out of your comfort zone and you are not aware of that you have to take a step out of your comfort zone. But the most important thing is your mindset. Shaky mindset don't become achiever. You have to have a very strong mindset. Why it is that important? Someone messaged me that, ma'am, I want to appear for the FAB exam, but I have not decided yet. Maybe if I will not be able to join the FAB attempt, I will go for the June attempt. What is this? Is this a strong mindset or a shaky mindset? You don't know what you want to do. If you have an option, there is a loophole for you that you can or you cannot go for the February attempt for the FOP or the TAS. Then obviously, and you have secured like, I will definitely go for the June exam, but I am not sure about the FAB attempt, but I am trying to prepare myself for that FAB attempt. What do you think? What will happen? You are definitely 99%. I am obviously I will say that it's 100% surety. I am going to give you that you are going to attempt for the June, because you have a loophole. You will go easy on yourself, and you even don't know what you are going to do. So you are not going to prepare for that FAB attempt. This is called a shaky mindset. You even don't know what you are going to do. And maybe when the time comes for the June exam, you will say, okay, there is an option for me for the October's attempt, maybe or maybe not. I will decide when the time comes. And when the time will come, you will definitely you will go for the October attempt, because there is a loophole for that you can skip this attempt. So this is not going to work, because by this scenario or by this mindset, you are not going to be there anywhere, because you are going to repeat this cycle again and again and again, and then you are going to asking yourself what is going to happen, what is this, why I am not able to clear my exam, and then you will just blame someone or some other people, and maybe yourself, that you are not able to do that. But so first thing and for the foremost thing is that you have to create a very strong mindset. We will definitely discuss all of these things one by one in our presentation. So which mindset you need? The mindset like when you want to succeed as bad as you want to breathe, then you will be successful. There is a picture of hand. You can see on your screens that this person, obviously he or she is in some sea, and he or she is drowning, and he is asking for the help. This is what is the situation? This is a do or die situation in which you are ready to do anything for your life. So this is the mindset when you will be that much hungry for the success, when you will be that much eager to clear or to pass your MRCPCH part 1 or 2, or even if it's single, whatever exam is that, when you will be that much eager, then only you can succeed that, and then only you can prepare your mind for that thing. So when you want that thing as much as you want to breathe. When have you people ever experienced of some respiratory difficulty, like if you have an asthma, suppose, and it's an acute attack, and there is so much hunger for the air that you will give anything for that relief from bronchoconstriction. So when you want that thing, or when you are eager, or when you are greedy for to pass that exam, that much you as you want to breathe, then only you will be successful. It will be a do or die situation, or you have to do that, otherwise you will die without it. Only then you can succeed in your life. And this is the difference between the person who are on the top and the people who are still on the bottom. This is the difference. Everything starts with your mindset, not in your exam, but in any phase of your life. Where the people who are at the top, they have very strong mindset. You may not know this before, or some of you must have known this before, but wherever you are doing your jobs, or wherever in your phase of life, just observe that the people who are on the top of the list, on the top of the situations, just observe them, how they are behaving. They have very strong mindset. They know what they want to do. And when you know what you want to do, then believe me, that is the day when you are going for the success, and when you are going for the top of the world. So you have to create this. And how? You have to create it by yourself. And then how will we proceed further? Obviously, the road to success is beyond. Then you have to make it into a goal, and then you have to make a plan, and then you have to put on an action, and then it will be a success. But what is the difference between a dream or a vision and a goal? We all have dream, I know that. All of the people gathered here, they have the same dream to clear your MRCPCH, and obviously the first step is the MRCPCH part 1. But what is the difference between a dream and a goal? A dream written down with a date or a timeline, it becomes a goal. When you have decided that you are going to take your June exam, FOP and TAS, then this becomes a goal with a very strong mindset. It's not like, okay, I will see that I can go or not for the June attempt. Maybe I can go for the September. No, this is not going to happen. When you have written down that you are going to appear for June exam, no matter what happens, then it only your dream will convert into a goal. And then what will happen next? When a goal broken down into the steps, then it becomes a plan. Then you have to work on your goal, obviously, because it's not that you have just put the timeline and you are just sitting there and waiting for miracle to happen. Obviously not. You have to prepare yourself for that. And for that goal, to achieve that goal, to pass your exam for the June attempt, you have to make a plan. And what happens after that? A plan backed up by an action, it becomes a reality. And when you will work on that plan, that study plan, and the multiple things will included in that plan, and then only when you act upon it, when you will come out of your comfort zone and will take the first step to act upon your plan, then only then you will succeed. And there is no way that you cannot succeed with these things. Then how to convert your goal into a to convert your dream into a goal? You have to know your background. I receive a lot of messages that I want to appear for the Fab attempt or for the June attempt, but I don't know from where to start. The first thing I ask them is, what is your background? Have you done your graduation just yet? Have you completed your house job? And what are you doing now? Have you any experience in pediatrics? Are you a PGR? You are doing postgraduate training in your respective country? Are you doing any job currently? What is your status? What are your phases in your life? How much time do you have in a day to spare for the study? Then how much knowledge already you have. It may be possible that you want to appear for the MRCPCH, like it is for pediatrics, but you are currently doing a job in gynae because you were not able to secure a job in pediatrics. Then how can you do that along with the gynae job, and you are going to read the pediatrics, or you are going for, you are doing a job in the surgery and general surgery, and you want to appear for the, just because you were not able to secure a job, then all these things matter. Then all the other you have your family matters. Do you have kids? You have to give time to your kids. Obviously there are financial problems. Are you able to secure that much money for the attempt for the payment of the exam? Obviously then you have parents, you have many other responsibilities in your life. So all these things gather, then only I can tell you about, okay, you will be able to prepare for the exam in 3 to 4 months, or in 6 to 8 months, or in a 1 year. That totally depends upon you. And believe me, only you can tell me these things, and I can only guide you, or only I can suggest you. The only person who can tell that he or she can prepare in that particular time is you. You know about very well about yourself and your situation. So you have to analyze yourself. You have to do self-assessment, that whether you can go for the fab attempt, you can prepare yourself into 3 to 4 months or not. Then you have to collect the evidence, that what is this exam is all about. You can take evidence, or you can take guidance from someone who has knowledge, who has experience, who have passed already exam. You can take knowledge from the website, from the RCPCH. There are many data available on YouTube videos, in different preparation groups on the Telegram, Facebook, in the WhatsApp. You can take knowledge from anything, anywhere, from whatever is available for you. And you have to just collect the evidence, that what is it all about, what is FOP, what is TAS, what are their exam patterns, what I have to do to prepare for these exams, what is it all about. Is it diagnosis, it is management, it is just sign and symptoms, or it is anatomy, physiology, pharmacology? What is it all about? How much time is required for me to prepare for these exams, whether I want to go for the FOP only, whether I want to go for the TAS only. Then you have, when you collect all this evidence, all the data about the exam, then you have to self-evaluate where you stand. Where do you stand? Whether you have some knowledge, some pediatric experience already, and you can easily, you can go for, and prepare for in about 3 to 4 months for the exam, then it is okay. If you don't have anything, you have to self-evaluate yourself. Then maybe it requires 6 to 8 months for your preparation. Then you cannot go for the fab attempt. You have to aim for the June attempt. Only then, only you have to evaluate and self-analyze yourself, and then you can decide when you can go and appear for the exam. Then there are the confounders, obviously, which are going to affect, like there is a family or to which you have to go give your time. You have kids, you have parents, you have different responsibilities. There may be some religious festival, there may be some wedding ceremonies, there may be your job responsibilities, and you have 30 to 34 hours call, and you are not able to prepare that much for the exam. So there are many things which are maybe you are a mother, you have to take care of your home also, and you have to take care of your kids also. So you are not able to spare even 1 to 2 hours for the exam, for the preparation in a whole day. So all these things you have to take into the account, and then you have to decide that whether you want to go for the FOP or the FOP separately, task separately, or you have to appear combined in one day. And at what time, like it's for after 3 to 4 months for the fab attempt, or it's for the June attempt, or it's for the October attempt. Then only you can decide, and then this is the decision, and then it is your dream. You have put a time limit on that, and it is converted into your goal. This is the biggest mistake which I have seen on my daily basis that students are doing. They have no preparation. They just want to appear in the exam. They want to secure a seat by hook or crook, but they don't know from where to start. They have not started any preparation, and they just have secured a seat, and then they start messing me. I have secured a seat, but I don't know where to start, because I have not done any preparation, and I don't know from where to start. Then I told them, I asked them, why did you go for the exam, October exam, if you have not secured, and if you have not started even your preparation, and even you have no knowledge, and you have no pediatric experience. So this is the thing, first thing and first mistake. Please, when you want to, you have to analyze all these things, and then you have to set a time limit that you want to appear for this exam. And then you have, because and then you have to start preparation for that before securing a seat. It's not that you have secured a seat, and after that there are only 2 to 3 months, and then you just start preparation for that, and there is not much at that time you can do, and it will only panic, and there will be only anxiety and depression, and there will be stress, and you have no idea how to cope your stress, how to get out of that depression, and you will go morally down, down, down. And what will be the ultimate result? That you will not be able to ace your exams. So this is the first thing you have to keep in your mind, and this is the really, really important thing, which 95% students, I can say that they just ignore this thing. So you have to have a very strong mindset, and then you have to prepare yourself. You have to make a whole schedule, like how you are going to ace this exam right from the start, just putting a timeline for your exam. Then you have to make a plan. Now you have, suppose you have decided for the June attempt, and then you have to plan how you are going to prepare for that June attempt. First thing is that you have to seek guidance. Obviously, if you are new into the MRCPCH world, then you will not, some data will be available if you have researched all these things, as I told you in the previous slide. Then there are many YouTube videos. Again, I will say that all the groups on the Facebook, WhatsApp, and the Telegram are full of information. You have to seek guidance, and if still then you are not able to understand what is this exam all about and from where to start, then you can ask someone, you can ask me. I am always here to help you. You can just text me, and I will tell you all these things about you, all these things. And then or some other mentor or some other person whom you trust, you can ask and you can take guidance. Please ask for help whenever, wherever you are lagging. Just don't be shy. Then you have to collect the materials. They will tell you about all these things. All the materials are available all over the net, all over the Telegram, WhatsApp, and Facebook groups. But there's many data available, but you have to think wisely and you have to use them wisely. You have to obviously need guidance for that thing also, so you can ask anytime. You have to collect that material, you have to download the books, and if you want, it depends upon you whether you like to study on the soft copy or you want hard copy. But I will advise you, please, whatever book you want to read, just put it in a hard copy, because the thing which you have written with your pencil, with your hands on the book, it has long memory as compared to what you are reading or highlighting on the soft copy on your tablet or on your mobile, or on your laptop. So you have to collect the material, and then you have to download it, and you have to make a hard copy of it. Then you have to make a study schedule. Suppose if you're going for the June attempt and you have 6 to 8 months, then you have to make a study schedule according to your timeline, according to your time management, that how you are going to manage it all with your family, with your job, and how much time you can spare in a day for the exam. Like it's 1 hour, 2 hour, 3 hours, 4 hours. So you have to make a study schedule according to your time, and obviously you have to give your time, which is we call as the layer time. You have to spare one a day, just like we have off day on the Sunday. So you have to have an off day on the Sunday to spend it with your family, your kids, your parents, your brothers or sisters, or your friends, to just freshen up, to get all this anxiety and to get out of all this anxiety and the depression. And then you have to build connections. You have to have a very good study partner along with you. You have to join different groups on the WhatsApp, on the Telegram, on the Facebook, which are active and where there are actively discussions going on of the past MCQs or the past test or different topics they are going to discuss, because that is the good memory. When something is going on in discussion, suppose one person has just posted an MCQ and you just answer that question, but it was a wrong question. That person may tell you, or that mentor, whatever your group you have joined, in which there must be a mentor who will guide you that this is not the right option. Then you will ask why this is not the right option, and then he or she or other student or other your friends may tell you that these things, these signs and symptoms are not present in this question, so that's why this is wrong option. And these things are present, which are going towards this diagnosis or this management or this option or treatment of choice. So that's why this is the right option. Believe me, this is what happens in the exam. Even when I was doing my exam back in 2 years back, then what happened? The same thing happened to me. There were many questions which were from the past recalls, and I was very happy. Oh yeah, I have discussed this, I have discussed, I know this, I know the answer. But there were few questions, like 3 to 4 questions, which I marked them when I was preparing for my exam. I marked them that I will read them in the morning of the exam, but I totally forgot to read that, and I was having no memory of that, and I was cursing myself sitting there in the exam, that why did not I read that, and why did not I take part in that discussion when this was going on? Why did not I read at night that discussion? I may have remembered something from that. So this is very important, and believe me, I attempted my whole question, my whole paper just like that. I was remembering, recalling, okay, there was that person who was telling me this was present, and that's the right option. I marked it wrong, but this was the right option. So this was how I attempted my exam, and this is the same thing happen with every student, believe me. And then you have to attend the mocks, as much as practice you can do of the past test or the past recalls or the MCQs sample papers. You have to do that. This is your key to success. Then what is the next step is you have to act on it. You have to put your plan into the action, because idea without action is nothing. Then you have to, next thing is you have made a study schedule, and now you have to come out of your comfort zone, and you have to actually start studying, and you have to actually spare some time from that, instead of scrolling just on the Instagram, Facebook, and in different Telegram or the WhatsApp groups. You have to actually open your books, and you have to study that. Obviously, it's a very difficult thing to start studying, but this is the first step. First step is very difficult in any phase of life, but once you have conquered it, then it will be a very smooth road, believe me. You have to get out of your comfort zone, and then consistency. You have to be very, very consistent. It is not like that you have started studying today, you have studied 2 topics, and you're very happy that you have studied 2 topics, so I tomorrow I am going to take an off, and I will see that after that. No, this is not going to happen. You have to, even you read 1 topic, even you read half topic, you have to study daily, except your off day. That may be like someone, for it's Sunday, maybe it's Friday, it's Saturday, it's up to you. But you have to study each and every day, and you have to be consistent. You have to have a very positive attitude. You have to get out of your depression, your anxiety of the exam, or you should never give up, no matter how many times you fall, because there are ups and downs in your life. Obviously, something will happen. You are going very smoothly in your studies, and something will happen. Maybe your kid may get sick, maybe you get sick, or there may be some financial problem, there may be some problem at your job. Someone has said something about you, or you have done your proper work, but professor didn't like it, or your parents have said something to you, or you have some other responsibilities which you have to fulfill, but you are not able to do because of your busy schedule. There may be many things, and there may be too much things. I can obviously, this is our life, and this is what it life is all about, because life is not perfect. But just believe me. Okay, I am getting questions of I will obviously going to address one by one in the further, as we go in further slides, and obviously, and I will also answer your queries at the end. I am reading your chats, and just be with me, and I will answer every question of you. Then you have to build upon your strengths, and you have to review and fix your mistakes, and you have to be always in your learning mode and learn from the feedbacks which others are giving to you. So from where to start? Obviously, this is your first step. You are asking me from where to start. No, we know this is the most common question I get from on my Telegram, that from where to start. We don't know. We have exam in October, but we still have not studied anything. What should we do now? So believe me, I it's only 20 days left in the, I think, in the October exam, and what can I tell you? Okay, I will tell you accordingly, like what is your situation, how much experience you have, and I will tell you according to that something that you should rate this or this. But believe me, this is not this. Maybe you are able to pass with average scores, but this is not how you are going to ace this exam with excellent scores. Or you, this is not just passing the exam. Believe me, maybe some of your motives are that you just have to go through the exam. But for me, or most of the students, I think I know, they want to they want to be good at it. They want to excel in this pediatrics, in this MRCPCH exam. They want to be a very good pediatric specialist, and they want to have an understanding of each and everything. So let's just dive into it and see how, from where to start. When you are on your own, obviously you have not joined any course, or you have, your financial status does not allow this, or you don't want to join any course, or you are studying all alone. Then what to do? From where to start? Obviously, this is the situation in the picture I am showing you. I have prepared for the exam on my own, and I know your situation. You have no idea from where to start. There are so much data available on YouTube, different groups. Someone is advising some other one book, other is advising some other book. Someone is saying just do this and you will pass, and some other one is saying no, no, you are not going to do this. But from where to start? That's how you have to. What is the first step is you have to prepare yourself for that. This is the core key. This is the thing which I want, and I want to emphasize again and again. I can't emphasize on that enough, that you have to prepare yourself before booking the exam. You have to have all this knowledge before booking the exam, not after booking the exam. You come to me and, ma'am, please tell me how to start preparation. No, 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 no. This is a big no. By what is written here? By failing to prepare, you are preparing to fail. If you are unable to prepare yourself before booking the exam, then this is your preparation to fail. It means you are booking your exam to fail that exam, to fail the part one. So just prepare yourself. What I am going to tell you, you should know all these things before exam, before booking your exam. And what are the preparation problems? There is no shortcut, I am telling you. There may be shortcut, like you can go for the pass recalls only, and maybe you can give the passing score, but it's not going to make you a good doctor. It's not going to make you a good pediatrician. You will not have any knowledge of anything. You will just score the exam, that's it. And it will not help you when you are going for the UK job, because after MRCPCH you can go for the registrar jobs, and registrar job in the UK is a very, very demanding job. You should know each and everything. So maybe you can pass the exam just doing past recalls, and you will be very happy you have aced the exam with average score. But you will not be able to cope with the stress of the job, registrar job in the UK. So there is no shortcut. I am telling you, there is no shortcut. And because this is our attitude, this is our nature, that we try to find out the shortcuts. But believe me, there is no shortcut. Then you have many responsibilities. I already told you, you have job, you have family, you have kids, you have financial problems, you have busy routine, and most of you may not have any support available, because there are only few people who have very supportive spouses, or very supportive parents, or very supportive friends and family and colleagues on their back. But most of us, 90%, don't have any support. Even people make fun of it when you tell them that you are going to prepare for the MRCPC. They say, oh, you are going to prepare, okay, let's see that. So you have to prove them wrong. Then there is lack of orientation and guidance. This is the foremost thing. Following other footstep, this is a big mistake, and this is a big question mark, because we are not alike. We are totally different person, different people. So you cannot follow the other footsteps. You have, every person has his own a method of studying, so you have to follow yourself. You have to follow your method of studying, and you have to prepare yourself according to that. Don't listen to anyone who is telling me the I just did that, you can also do that. No, we are not same. And obviously you don't have lifetime for preparation, so you have to take the step. What is the first step? When you are preparing alone, what you want to do that. Just take a sample paper. It's available in every group, in every MRCPCH Facebook, Telegram, WhatsApp group. And if you cannot find those groups, you can simply go to the RCPCH website, and there you write down the sample papers for part 1 FOP and task in the search bar, and you will get that. You don't need anyone. And just download that sample paper, one sample paper only, and then try to solve that with the time limit, like it's 2.5 hours, and then try to solve that. Why and what will happen? That what will it tell you? It's going to tell you what is the exam pattern, what is FOP is all about, and what is TAS is all about. I hope so that every one of you know what is TAS about and what is FOP about. I'm not going into details again. And what are the type of questions? Obviously, you must know about them, these questions also, that there is a best of 5 and there are the extended matching questions. Then they will tell you what is the depth of knowledge required. Some of us have habits that we go, when we start reading a book, we go into the each and every detail of every topic. We want to cover from A to Z of every chapter. And this by this we are very satisfied that we have covered each and everything. But at the end of the day, what happens? We don't remember anything. We don't have any understanding of any topic. This is what usually happens. So you don't need this. You don't need each and every line to read every chapter. You just need what will this practice will tell you of the solving the sample paper, that what is the depth of knowledge required. There may be only two things required, like you will only need sign and symptoms to diagnose a patient, to diagnose a condition. Maybe they don't ask you about the investigation and the management. This is what happens in the task exam. In task, they only give you sign and symptoms and ask for the diagnosis. In the FOB, they ask you diagnosis, and they can also ask you about the investigations. And in the AKP, there is the totally focus on the management of the disease. And in the task, you only know, maybe you only want the anatomy, pharmacology. You don't need to remember the drugs for the, like, what is the management for the task, but you may know the pharmacology of the different drugs related to every system. So it means that you don't need to read each and everything. You just have to be target oriented. This is a target oriented exam, and you have to just study accordingly. Then it will assess the assessment of the strength and your weakness. Maybe you are good at cardiology, but you are very weak at neurology. So you will know that you have to spare at least 2 to 3 weeks to neurology, and you can go for the cardiology in 1 week. This is how we are going to prepare for exam. This is not that we will make a study schedule. We will give 2 weeks to cardiology, we will give 2 weeks to neurology, we will give 2 weeks to GIT. No, you should know what is your strength. If you're good at cardiology, you can give 1 week time. But if you are not, if you find the neurology very difficult, then you can give 2 weeks to neurology, or you can give 3 weeks to neurology. Then there are some things like in the task. What happens? There are about 10 to 15 questions of the pharmacology. This is the biggest portion, is the pharmacology in the task exam. So you have to spare a very good amount of your preparation time on the pharmacology. And then there are related to the ethics, there is only 1 or 2 questions of the ethics in task, while there are about 4 to 5 questions of ethics in the FOB. So you see that there are different percentages. In the task, there are only 1 to 2 questions of ethics, and in the FOB, there are 4 to 5 questions of ethics. So you have to spend different amount of time for the task and different for the FOB. Similarly, there are 10 to 15 questions of pharmacology in the task, and while there are only 1 to 2 questions of pharmacology in the FOB, you can see that a major what I have analyzed, that biggest portion of the task exam is the pharmacology. Maximum questions come from the pharmacology. So your whole focus, your maximum time should spend on the pharmacology, while only 1 to 2 questions for the FOP exam from the pharmacology. So you can see that you have to select the time. You have to dedicate your time accordingly, according to the systems from which the exams are coming. The maximum, there are 5 to 6 systems in TAS and 5 to 6 system in the FOB, which make maximum portion of the exam. And then there are minor subjects, and from every minor subject there are 1 to 2 questions. From some subjects there are 2 to 3 questions. So you should know these things, and you have to make a study schedule accordingly to dedicate time to every subject according to their portions. And you have to assess your strength, so you can minimize your time on that subject. And you have to see what is your weakness accordingly. Then you have obviously time management according to your business schedule, and you have to focus on the key areas like I told you already. And you have to assess that whether you need guidance or not. If you need guidance, please ask, don't shy. I am all, if you want to ask me, I am always there, and I am to help you, to guide you at every step of your journey. If you want to ask someone else, please ask. I will just say please ask. Don't be shy. Ask before the exam, before ask when you have enough time to prepare for the exam, not just when the exam is on the verge and you are texting the person that how can I prepare, and there are only 20 or 10 days left. No one can get you through the exam at that time. So just ask when you need help. And what was this all about? It was telling you where you stand and how you are going to prepare yourself, how you are going to make a study schedule, how on which areas you have to focus, how much time you have to give a system, one system, and how much time you have to give to the other system. But when you join, this is when you are joining, when you are preparing alone. But if you decided at the end of the day that you are not enough prepared, you have not enough knowledge, and you cannot do it alone, then you can join any course accordingly, whatever you like. I'm not going to tell you that just join us. This is not what this webinar is all about. There are many persons, they are arranging the courses for the MRCPCH part 1. You can join anyone of your like. Everyone is very good. But if you join us, I am going to tell you what we are going to provide you. Obviously, we have a website. You will have your own account. As soon as you will join us, you will be given your login of your account, and you will be added to our Telegram premium study group. Then there will be 40 plus live focus interactive sessions. I prefer the live sessions because in every live session, there is something new. If we provide you with the recorded sessions and you are seeing them again and again, then every day, every 3 months, guidelines are changing. Every 3 months, every day, there is something new in the research which are going to be implemented in the routine clinical practice. So in every live session, we tailor our lectures accordingly, something new. And whenever we are teaching, there is something new coming to our mind, which we are going to tell you that you have to study like this, you have to study like this. This is the main symptom, this is the main diagnosis, this is the main investigation, and this is the main treatment. So I prefer to join you live focus interactive session. But if because of any reason you are unable to join the live session, you will be provided with the session recordings accordingly. It will be uploaded onto your account on the website according to the schedule. If we have scheduled, according to schedule, we have respiratory sessions, then it will be the recorded session will be uploaded the same night on the website, and you can see according to your feasibility. And it will be available there until you pass the exam. What will we teach in those live sessions? It will be targeted study. I will tell you in the next slides what will be the targeted study. We know that what topics are going to be in the exam, what are important topics given by the RCPCH, what portion making the maximum questions, what system is making the maximum question for the TAS and for the FOB, and what is the least important in both exams. And then what about the clinical cases, what about the guidelines? This is all going to be covered in those lectures, and you don't have to go back and forth and opening one book and one after another book. Like first you have to go for the clinical cases, then you will remember something, okay, no, I need to see this from the guidelines, then you will back to the SOP, and then you will back to the illustrated textbook of the pediatrics, you don't have to do that. All the material, all the data from all these 4 to 5 books we will provide in the live interactive sessions. Then there will be obviously 24 hours discussion in a premium study group, and obviously it will be mentored by it will be supervised by mentors. We have 3 mentors in the part 1. And why there are 3 mentors? Because you can see that if one person is going to teach you each and everything, there are 10 major systems and there are 12 minor systems for FOP and the TAS exams, and one person is covering all those 22 systems, 10 majors and 12 minors, then what do you expect? He or she may exhaust at the end of the day. But if we have divided all these things into 3 mentors, like if I am the one, then I have 7 to 8 systems, some major, some minor, so I don't exhaust myself. Similarly, other mentors also have those, so that we master each and every system. If I have 2 or 3 major systems, I am going to master it for you, and obviously, and you will have no difficulty. I am going to provide you each and everything about that system, and I will solve each and every past recall for you from from you with my research, with my guidelines, with my whatever, from wherever I have to recruit the data, I will do for that. Similarly, if the other mentor has other systems, he or she is going to master that for yourself, and she is going to provide each and everything in her lecture for you. So it will be a divided work, so that each one is the master of whatever he or she is teaching you. So this is the benefit of having 3 mentors, and they will be present in the in a premium study group, which will also we divide the days so that you can have your queries, and the mentors also doesn't get exhaust because of 24/7 mentoring. So this is the benefit of having 3 mentors instead of the only one person who is going to teach you all 22 systems. There are 10 major systems and there are 12 minor systems. You can have an idea how much difficult it is for you, obviously, and for the person who is teaching you. Then there will be practice pool questions, individualized focus. We obviously, if someone has any difficulty at individual level, we will address that and we will focus on what is he or she is going through, and we will see what we can do, and we will provide support. And if they need individualized schedule, we will obviously provide that. Then there will be monitoring of your performance. This is the big benefit for you on the website, because at the end of the, suppose we have lectures respiratory, and we have covered the system, then at the end of the system you will be given the time to read by yourself from the obviously books and whatever material you want. We will provide you obviously with the material. We will guide you how you are going to teach, and from where study, and from where you are going to study. Then at the end of your respiratory exam, respiratory lectures and the preparation, there is going to be a mock exam that will be uploaded on the website on your account, and you are going to attempt that. And how will we monitor that? We will monitor that, are you attending the live session or not? If you have not attended the live session, then we will see that you attended or have you watched the recorded session or not. If you are not watching attending the live session, and if you are not watching the recorded session, then obviously we will contact you and we will ask you, why are you not studying? What is the reason? If there is any ambiguity, if there is any problem, please tell us and we can solve that. If you are going through any phase of life, we will support you. If you are having morale, if you are having any anxiety, if you have any depression, we will try to get you out of that, and we will provide support at each and every step. But you have to study, and we will make sure you are going to study with that. And if you are attending the live session, or if you're going to watch the video but you are not attending the mock, then again you are at our watch, and we will ask you, why are not you attending the mock? And we will force you, and obviously, because this is for your sake, this is for your preparation. This is what we are doing, is going you pass, or you are going ace the exam. So we will ask you attempt the mock, and obviously we will monitor your performance, that how much question you have marked the right and how much question you have marked the wrong. And we will obviously discuss that. And if there are any difficulty or any in understanding any that particular topic which you have marked wrong, then we will obviously address that, and we will again provide you with a new session. Then there will be system wise mocks, I have already told you. Then at the end of the 10 major systems, there will be a grand mock of the major system. Then after the end of the 12 minor subjects, then 12 minor systems lectures, there will be a grand mock of that minor system. And then we have covered all these things, major and minor systems, and then there will be a grand mock of total exam, total systems. And then obviously there will be morale boosting at every step of your journey. This is how you can prepare yourself. And obviously what we are going to do that, the person who were asking how we can make a study schedule and how we are going to like rough study schedule and how we can take an initiative. This is an example. Suppose this is the respiratory system, like respiratory and ANT, they are combined in the task and the FOP. According to RCPCH, what you are going to do, you are going to write down the important topics from the, for the task, your main book is the SOP, and for the FOP, your main book is illustrated textbook of pediatrics along with the guidelines, along with the clinical cases book. And for the task, it's only SOP and the clinical cases book. And the videos or the YouTube videos, whatever you want to read, or the images from the Google you want to see, whatever helps you in the pharmacology or in the anatomy or the physiology. So you have to just mark your I'm sorry for, I think there was a disruption. So you just have to write down your important topics, what is going to come in the exam. And suppose I have like I have written down here for the respiratory plus ENT. Then we will provide you with these topics along with the SOP or illustrated textbook of the pediatrics, like from where you have to read that topic from which book. Like I have written down here that is congenital malformation, you have to read from the SOP. Then there's the physiology of breathing or the oxygenation, you have to read from the SOP. Then if there is a mechanism of drugs commonly used in the respiratory, there will be a PDF file provided to you. Then there may be some lecture notes provided to you. Then with every system, like there's a respiratory system, then there are the clinical cases. So I have write down here clinical cases 2, 3, and 4. These are the task clinical cases, and these are specifically for the respiratory. So what you are going to do, you are going to make a list of the important topics. Then you have to see from where you have to read that. And then you have to identify the task clinical cases books. What are the cases here in this book, or for the respiratory or for the cardiology? And then you have to read that cases book along. Suppose you have studied respiratory, so you have to read that important topics from whatever book you want. And then you have to read that clinical cases along with that. Clinical cases along with that topic. Similarly is the FOP examination, like we have to write down the important topics. Then we have to read them from the respective book. Along with that, there are the clinical cases for the respiratory. I have written down here 5, 10, 27, 28, and 32. So you have to mark those clinical cases for the respiratory system, and you have to read that with your respiratory system after reading it from the respective book. And then there are some guidelines, like here guidelines for the respiratory are asthma, croup, bronchiolitis, and the pneumonia. So you have to read those guidelines along with it, and it will then complete your whole respiratory system. And this is how we are going to do in our exam, in our course. Obviously also we will provide with the topics, with the clinical cases numbers of the respective system, and the respective guidelines which you have to do, and with the topics from whatever book. Like if it's from the SOP, we will provide with that. If there's a PDF book, if there are the lecture notes, we will provide with that. And same case you can do with your study schedule. Just write down each and every system, and then important topics, then important clinical cases of that system, and important guidelines. make a system like this, and then you see, and then you then observe or self-analyze that how much time is required to complete this one system, and then allocate time accordingly, as like maybe it's 1 week or 2 week, and maybe it's 2 weeks, so you will complete this whole scenario, his whole system in 2 weeks. Sorry. So it will cover all of the things, your clinical, it will cover your clinical cases book, it will cover your guidelines, and it will cover your illustrated or SOP book. So you don't, and one thing I want to advise you, make notes. Just keep one book along with you. If you can make notes on the illustrated book, or you can make notes on the guideline book, or you can make notes on the clinical cases book. So you don't have, when you are going to revise that, you do, or you can make new notes, another copy notebook for that. So when you are going to revise, you only have one book. You are not going to again read, open again and again the clinical cases book, again and again the guidelines book and SOP and illustrated. At the end of the preparation for the revision, that is the 1 month for the revision, you have only one book, and you are going to read only that book, only important topics, important points which you have extracted from your first reading. Okay, because there will be no time at the end for whole reading again and again, and there will be so panic and so anxiety and depression at the end of the preparation, that you just give up, that I am not able to do that. That's why the notes are very, very important. So you have to make the notes, take one book, and most of these things are similar in the clinical cases and the SOP. So you just have to take one book, and whatever additional information you get from the guidelines or from the cases book or from another book, just read it on the one single book. And this is how you are going to make a study schedule, and secure 1 month before exam for the revision. This is very important. Revision is very, very important. You have read that all the theory. Now what are you going to do is next recalls. The most important thing in your preparation is the recall, and it is best to if you do the last 5 years recall. But if you are unable to do, you don't have any time, please at least do last 3 years recalls. It is very, very important. It's just like your heart, you cannot survive without your heart. It is the same that you cannot pass this exam without without going through the recalls, because they make about 75% paper of the exam. They are repeated. 70 to 75% exam will be repeated, and maybe there are 25 to 30% new questions. So this is very, very important, very, very crucial. But remember that there are a lot of mistakes in the past recalls. I am seeing it on daily basis while we are practicing in our premium study group, that past recalls we are doing system wise, that there are many mistakes. Why there are mistakes? And just don't get like when they are written 100% cardiology and 100% respiratory or 100% ethics, maybe obviously they have got 100% in that thing, but they have provided you with the recall. Maybe the question which they have seen in the exam have that option which they have marked the right and said that I got 100% by marking this option. But we are humans. Are they able to recognize, or they are able to remember each and every particular thing and detail of that question or scenario to provide you? No, this is not, they are not able to. They may be only 1 to 2 lines, and then they are given the options. So please don't just ratify the correct answer just because they have written 100% respiratory, 100% cardiology, 100% GIT. Analyze yourself why you have read these books, guidelines, clinical cases book, SOP, because you have to make an understanding that what is right and what is wrong, how to attempt the question. So you have to read the recall, you have to mark the option what is according to you is right. If it is different from the option which they have marked, then go and research it, that what is right. Open your books, open the Google, open the Medscape, open the up to date, whatever data available, open that. If still you are unable to answer that, then you can ask in the different groups available which are supervised by the mentors. You can ask me, you can ask in our groups. It's totally open invitation. You can ask. And if you are you want to ask some other person, you can ask them, but you have to confirm each and every question of the past recalls. Just please, please, please don't ratify it. Confirm from the authentic source, and just don't focus on the right answer. Please understand why other options are wrong. So because these are the wrong options which are available, they are going to make you an excellent and excellent pediatrician. Because if you know that every person can tell me this is the right option, but a very few can tell me that if the others are wrong, then why are wrong. And that is where the difference is made. These people are the one who are going on the top of the list, who are going to score the top marks in the exam. Because if you can give me the reasoning for the wrong options, then I can assure you that you are going to pass this exam with in one go and with excellent scores, and you are going to be an excellent pediatrician. You will not be having any difficulty at any level of your career. So just don't focus on the right option. Obviously we know that this is the sign and symptom and we are going to mark this option, but please also focus on the wrong options, why they are wrong, what is the reasoning, what are the things which are present in the question which make them wrong, and what should be what if these things will be present, then maybe this wrong can go right. Don't ratify correct answer. I already told you this is happening. This is happening on the daily basis. And I am telling you from the very first day, please don't ratify the correct answer. Even very good students, as I am we are practicing in on the premium study group, very good even the students, they just like they see this is a question, because I am not going, because I am providing them with the total 5 options and the whole STEM scenario, and I am adding the options from also from my side to make the total question different. So they are just saying, oh, this is the STEM, okay, this was the answer, and they are marking those ratify answer from the past recalls. Don't do it, don't do it. I will again and again tell you, don't do it, don't ratify the correct answer, because the past recalls are repeated. Maybe they are 30% same recall, but the remaining 30% they have altered something in that scenario. They have altered one or two option, they have altered two sign and symptom. So what you are gonna do then? You are gonna mark the same option? No, you have to understand. You have to be very good understanding of your topic. You have to be you have to have very good grip of the topic, so you can differentiate between these things. Make an understanding, obviously I already told you, and why you have to do that, because 75% repeated in the new paper. How to solve recalls? You have to segregate every system MCQs. I think many of these things are available in the different groups. For the FOP, it is available categorized exam according to the system up till I think 2020. After that, there is no segregation, and for the task, it's not available. So try to segregate it. We will provide segregation in our course, obviously, to our students. We have that, but if you are studying alone or with one or two friends, then divide the systems, and you can easily do it into 1 to 2 days, or 2 to 3 days maximum it will take that, and you can do that. And when you complete one system, suppose you have completed the cardiology, then please revise those past recalls of the cardiology, and it will clear your concepts clean and clear. It will make your concepts clean and clear, believe me. Do it along with the system you are covering, and make a hard copy, make notes of every option on it. Try to, if at least, try to at least like 5 to 6 papers to make them in the hard copy, and solve them on those papers, and mark the option right, why it is right, and if the others are wrong, then why they are wrong. What are the signs and symptoms which are favoring the right option, and what are the things which are against it, and which are for the wrong options. then start from the very first day. I am not going to tell you just wait for the like 3 to 4 months and start it in the last month after going through all these books and all that. I will advise you start it from the very first day. You can solve at least like 5 to 6 questions per day, and but it's not like just solve the question. I am asking you, advising you to solve from the first day to make a very good understanding, as I have told you previously, that you have to make it with full topic grip. If you are having a like a question of infective endocarditis, then you should be very, you have MCQ of infective endocarditis, then you have to be very clear about that, to whom the you have to give the prophylaxis, to whom you are not going to give the prophylaxis, what is the procedure for the dental procedures you are going to give or not, in which cardiac lesions you are going to give, in which cardiac surgery, in which surgeries you are going to give or not. Whatever is about the infective endocarditis, you have to have a very good grip on it. This is how you are going to solve your MCQs or your past recalls. If you get a topic, if you get a question from one topic, you have to master that topic. It's not just the ratify the answer and then go on to the next question. No, 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 a big no. You have to make it an understanding. If you are ratifying your MCQs, this is how you see there are two brains. If you are going to ratify your answer of the past records, this is how you are going to be. You are not going to be confident in your exam, and you will be very shaky. You will be having anxiety. You will be having panic attacks. But if you have complete understanding of each and everything, then this is how you are going to be. A very smooth, you will be very calm, and you will not, you will be very confident, and you are going to waste your exam. Then you have to spare your time for the revision. As I already told you, at least 1 month before the exam you have to complete each and everything, and that 1 month is just for the revision. Obviously, I told you you have to make notes, and you are going to revise from those notes. You are not going back and forth into your books and panicking, and you are going to have anxiety and one after the other panic attacks, and then you are going to messaging to people for the support. I don't know, I am having anxiety, I don't remember anything. Don't do that. Make, this is how the strong minds do that. Each and everything prepared beforehand, so that at the end you don't panic. You are very confident that I have notes, I am going to revise that, and this is how I am going to ace my exam. Then repeat recalls. And if someone is offering marks, please, I will advise you, please take those marks. These are very important. This is, they prepare you for the exam, not just according about like offering you the knowledge and all those things, but preparation means they are this is how you are going to conquer your anxiety, your panic attacks. Obviously, you will prepare yourself with the time management, like how you are going to like attempt your 70 to 80 questions in those 2.5 hours. And this is all about exam. And once you have done that, then you will be very confident in your exam. And I will advise all of you, please go onto the RCPCS site before the exam, like 2 or 3 days exam, and there is a demo available for the exam. Because you don't know about the how to attempt the exam, you are repeatedly asking, will the, can I skip the question, can I, will the how many times I can skip the question, will it appear at the end of the exam, how many times it will appear at the end of the exam, how will I know that how many questions I have skipped. All these things are available on the RCPCH site. And there's a demo exam available of about 20 questions, I think 20 to 30 questions. So it is just like the real exam. If you skip one scenario or one question, it's going to appear at the end of the exam, and there will be, it will be marked that you have not flagged. It will be flagged. There is a flag on the left side of the question. It will be flagged that you have skipped this question, and it will appear at the end of the exam. Then there will be a counting going on along with on the right side, that you have attempted this much questions, like you have attempted 50 out of 80 questions. So you know that I have remaining 30 questions, and there is only 1 hour or only half an hour left. So you should you should keep up your space according to that scenario. So it will be a very good practice if you go 2 to 3 days before to the RCPCH demo exam and just attempt it, and you will be familiarized to the exam, and it will decrease your anxiety. Obviously, have a good what are the essentials to success. Have a good grip by making a good understanding. You have to strictly follow your schedule. Whatever schedule you have made, you have to be consistent with it. It is not possible that you study for the 2 days and then you take a break of the 2 days. No, this is not going to happen. You will forget each and everything what you have read in the previous 2 days. So you have to be very strict about with your study schedule. Practice as many questions as possible. Discussion plays a vital role. As I have already told you, I have also given you my experience. Please actively participate in the discussion, whatever in which group you are and whatever the discussion is going on. But also don't blindly follow the discussion. Confirm it from the authentic sources, from your books, from your guideline, and see what is the right option and what is the right, which person, what they are going to tell you. Then routine is a must, and never lose hope. Never ever lose hope. Then stress, a very major factor, a very major factor is the stress. So you have to cope with it. Because this is going to affect your grades, this is going to affect your performance, and life is not perfect. Obviously, there are hindrances, there are obstacles, there are difficulties, there are challenges. This exam is very difficult, and you have to make it easy for yourself by going easy on yourself. You have to love yourself. You have to be confident in yourself. You have to let go self-doubt. You have to give yourself a margin that you are a human, and you have to prioritize according to your phases of your life. If your kids are important at this time, then prioritize themselves. If you are going through a phase of life where something else is important than this exam, then please prioritize that thing. But if this exam is for you, do and die, then prioritize this exam. Make time for this exam. Just forget each and everything in just these 4 to 5 months, and just focus on yourself. Believe in yourself. People are always there. Let them say whatever they are saying and do whatever they are doing. It happens with every person because people demotivate you. People try to pull back you, but don't listen to them. This is what they are made of. I think I can say that this is their nature. Just keep going on and believe in yourself. I am again telling you, believe in yourself, love yourself, and just let go of your self-doubt. You can do that. If you are here attending, I can obviously tell you that I can assure you, each and every person who is attending this webinar, that you are going to ace your exam, because you have spared your time from your busy routine just to attend this webinar, and you are listening to each and everything which I am telling you. So do you think so that there will be no difference among you and the person who is not attending? Obviously there will be a difference. You know that, I know that, and I am going to tell you, if you apply all these things in your preparation, you are going to ace it. You are going to be a very good and excellent pediatrician, and you will not be having any difficulty at any level of your career. And believe me, all of you, I can tell you that you are going to pass your exam. Just write it down and message me when you are done with your exam, that you are, and it will be that day when I think that will be my goal. I have achieved my goal, because that is my goal, to make you through your exam. So that will be the day when I will be having have achieved that my goal. So you are doing the best you can. Whatever you are doing, whatever you are trying hard from your busy routine, making time to attending the webinar, to having to take part in the active discussions in the group, and you are studying very hard. So you are doing the best you can, and now you have to just pray to Allah that He will succeed you. Then what is how to attempt the exam? Obviously, I told you that practice. You are ready, and you are going to practice demo 2 to 3 days before on the RCPCH website. Then one day before, you are going to have a very, very good sleep. Please, 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 this is very, very important. I am telling you, if you are unable to sleep, please, this is the routine for the people. For the many students, I have seen that they take the any anti-allergic medication, which make them sleepy, or any antidepressants which make them like sleepy. So please, if you many of you may have tried that, but I will not advise that. But I will just advise that one day before, just relax, watch any season or any maybe drama on something, or on Instagram you can scroll that. Just relax, make it have a very, very good sleep, have a very good dinner, and have a very good breakfast on that day. Be confident, you are going to ace this exam. You are, don't self doubt, please don't self doubt that day. You are going to achieve that. Be confident, be calm, don't get panic attack, don't be in your depression, get out of that. When you are confident in yourself, these all things will vanish. Then you have to do the time management, obviously. And I will advise you, keep chocolate and water with you. They allowed you water with in a see-through bottle, like we have all disposable bottles. We take them from the marts. So you please have water, and they also allow you the chocolates along with you. So please, because chocolates are the sugar level, there are many attacks of hypoglycemia in the exam. I have experienced of mine, so you will be needing their that. So please keep them along with. Be calm and pray to Allah. So, what's your level today now? What you have decided up till now? You can do it. I won't do it. I can't do it. I want to do it. Obviously, you are at many stages of life, in many different phases of life, and some of them I think are here. I want to do it. Some of have taken another step. How do I do it? Like I am having questions in the chat that how, ma'am, how to prepare a study schedule. I will try to do it. I can do it. I will do it. And yes, I did it. Yes, I did it. I will see after you. I think I will get the messages after the October exam. Yes, I have did it, or after the Fab exam. But at what step you are, you have to decide whether you can achieve it or not. It's totally depend upon you. It's totally depend on your mindset. So you have to decide that, and you have to decide after this webinar that what you are going to do, how you are going to achieve it. Then last but not the least, that pray as it is after everything depends on Allah, on God, and work as everything depends on you. Because Allah has promised us that there is ease after every difficulty, obviously. But we don't remember that ease, because we only remember difficulty. It was difficult, we were very worried, we were having different phases of life, it was difficult to we get into the depression, we were having anxieties, we were having financial problems. But after that, when there is ease, we forget about everything. And again, then we have difficulty, we say, oh, again I got another obstacle, what is this life? But we don't remember that ease part, that there were 6 to 7 months then when we don't have anything, any difficulty, any challenge, any obstacle. We only remember difficulties, but Allah has promised ease with every difficulty. So you have to work as everything depends on you. You have to work hard that much. But again, along with that, you have to pray to Allah or to God, as everything depends upon on the God. Obviously, everything depends on Him. But with hard work, we can change our destiny. Thank you so much. And now I will like to ask you, if you have any questions, you can ask me. I will try to answer the questions in the chats now. Okay. Shivram has asked me, is past test enough to crack part one? No, my dear, they are not enough. Past tests are only going to prepare you, or going to give you concepts about the different topics which are important for the TAS and the FOP exam. But they are, believe me, I have not seen any one question repeating from the past test. They are just there to prepare you just give you an idea about that. When you are preparing from the books or from the notes, whatever the from the guidelines or the clinical cases book, then I will advise you, you can go through the past test along with. If you have done the respiratory system, then you can go to the past test and go, just solve the past test of the respiratory exam, respiratory MCQs from there. It will clear your concepts very good. It is a very good source of practice. Whatever you have read in your books, in your SOP, in your clinical cases or guidelines, it will practically imply in those MCQs and will make your understanding clear. So you will be very well prepared with it. But it's not enough to get through the exam, I'm telling you. Then doctor is asking, Dr. Aqsa, can you tell how to start, make a rough study schedule for the FAB attempt? Beta, I think I have already told you all about it, how to design a study schedule, what things you need to focus, and if you want anything else, you can ask me in on my Telegram. Hi, ma'am. May I ask question? Yes, Tuba, you can ask question. Shivram, total question asked and time for each exams. Okay, there are, it depends upon the RCPCH. They want, usually there are 70 to 80 questions per exam. Like if there is task, there may be 70 or 80 questions, and similar is the FOP, like 76 or 80 questions. So exam is 2.5 hours, I think, in for every, like task, for the task there is 2.5 hours, and for the FOB there are 2.5 hours. If you're going to attempt on the same day, then FOB is in the morning and task is in the evening. I have did explain, Shivram, I have explained each and everything about the exam pattern of questions, how many questions are there, and the time, and how to book the exam in my previous webinar. It is available on the YouTube. You can go and watch the recorded section. Thank you. Jamal here, I think. Okay. Iram
Yes,
Nawaz,
ma'am.
Assalamu alaikum. I need details of the course. Iram Nawaz, you can contact the admin team. They will provide you with the details. Here, someone is here. Hello.
Hi, ma'am. I am Tuba. May I ask a question?
Yeah, sure, Tuba. You can ask. You have all rights to ask me. Please ask.
Thank you so much. Ma'am, I want to ask, as you have told that pharmacology, from pharmacology, there are 15 to 20 questions. I have
Mhm.
that what type of question, like, is there a mechanism of action or treatment about a particular disease? They ask for drugs, or like they want to ask about a particular group from which the antibiotic is, like what type of questions are coming? Because like we have read pharmacology in third year, and so we only uh, know the particularly about the diseases and their management, and the mechanism of action of that group of drugs.
Okay, Tuba, I have understood your question. This is a very good question. As TOS, I have already told you all about that. TOS is all about the basics. It's like anatomy. If there is the cardiology or respiratory, they are going to ask you about the anatomy and its physiology. Similarly, it's about microbiology and the pharmacology. In pharmacology, as it's all about the basics, so they are going to ask you about the mechanism of the drugs, along with it, their side effects, and there some one or two questions maybe on the half-life or duration of action. But most common questions are the mechanism of actions of the drugs and their side effects. Like if you are preparing for the respiratory exam, suppose, then what are the common drugs which we are using in the respiratory? There are, suppose if you are treating the asthma, we are going to use the salbutamol. So they will ask, they are not going in the task, they are not going to ask you like this is the patient of asthma known case and it's presented with acute attack, how will you treat it? No, they are not going to ask you. What they will ask you, this is the patient known case of asthma, for the last 2 years in asthmatic, and have 2 or 3 attacks in the previous 6 months, and now again presented with the acute attack of asthma, we have given the salbutamol, which he has responded. Can you please tell me what is the mechanism of action of the salbutamol? This is how they are going to ask you
Okay,
pharmacology in the task examination. Okay.
ma'am, I
And
have
same
one
is
more
the if
question.
they are already,
जी, जी, जी,
yeah.
yeah. Ma'am, you can talk. I will ask the
Suppose if
question.
the patient, okay, okay, if and suppose if the patient is already on some drugs, on inhaler, suppose the patient is on the steroid, then one type of question will be that patient is on the steroid or on the salbutamol inhaler, or whatever drug he is taking for the last 6 months or 1 year, then what side effects will you be expecting in this patient with this
Mm,
drug? So one question will be this, the side effect of the drug. These are the most common questions: mechanism of action and the side effects of the drug. Maybe one question of the half life, how many times it will take, how many hours it will, this is the half life of this drug, and how much time it will require to get out of the your body. So you have to calculate that duration according to the that half life they have given for that drug. And maybe 1 or 2 questions, these are not that common, but the other two things which I have told you, these are most common. Okay, now you
okay,
can ask me another question.
thank you, ma'am. Ma'am, I want to ask you that regarding POP, as we are
Hmm.
practicing in premium group about cardiology. So,
Okay.
you talked about infective endocarditis. Uh,
Hmm.
like we have read, uh, some people who have done FCPS, they know that we have used Nelson for that. So, some topics
Hmm.
which are very important, like infective
Hmm.
endocarditis or rheumatic fever or VST and talk, there is very less description. So, is it enough for
Hmm. Okay. That's uh, for that thing, like for the FOP, you only need the only sign and the symptoms of the disease to make a diagnosis. They are not going into the deep or detailed discussions like we are having in the FCPS pediatrics. For that, we have to read the Nelson whole book. This is not the case in this
yeah,
case. If you they in the FOP, they're only going to ask you sign. They are only going to give you sign and the symptoms, and they are going to ask you diagnosis. And what you can do there, you can read guidelines, because guidelines are very very important for the FOP. Whatever they are going
yeah,
to ask you about infective endocarditis, they are going to ask you from the guidelines. Because one type of question about, suppose if we take the topic infective endocarditis, in one type they are asking, giving you sign and symptoms, and they have asked the diagnosis, that is infective endocarditis. You can easily make the diagnosis by reading the illustrated test book. Then in the second type of question, they have asked you only the investigation which will you carry out in the infective endocarditis. Obviously, that is a blood culture. Then further management, they have each and everything has asked from the guidelines, like to whom you are going to give the infective and prophylaxis, to whom not you are going to give. All these things will be covered from the guidelines, from the nice guidelines which are given. Obviously, in the Nelson textbook pediatrics, these are the almost same guidelines. So there's not that much difference.
yeah,
But I think that is not necessary to read so much lengthy topics from the Nelson. It will only wastage of time. You already have that much
yeah,
knowledge. You just need to rectify it. You just need to refine it, and that will be refined by the guidelines, because guidelines are very very important. Even for the management, you need to read the guidelines, because they need answers according to their guidelines. We cannot tell them
yeah,
in the books. The management is written in general, but in the guidelines
yeah,
they have given specific scenarios. If this thing is present, then you are going to manage like this. So that's why whatever management or investigation you are going to read, you are going to read from the guidelines instead of Nelson. You can spend your time on the guidelines for a very good reading, and you are good to go for the exam.
okay. Thank you so much, madam. Thank you so
Okay.
much.
Okay. Okay, let's go with the other questions. Please, we are with Jamal is saying, Assalamu alaikum, Dr. Aqsa. Wa alaikum salam. Okay, Iram Nawaz, you can contact the on this number which is given. Jamal, okay, Dr. Shehzad here. I have completed MCPS training just now in pediatrics in one of the best institution in KP. I am now preparing for the MCPS 2 exam and want to appear in June, inshallah. So currently, which books should I start just for the time being? Um, you can start the clinical cases book, Jamal. Sorry, Dr. Shehzad. Actually, I don't. You want to appear in the June for the FOP and the TAS exam. I think I am taking it right. Is it right? So you can start with the clinical cases book for the FOP and the TAS. They are very, very good books. Even they are even good than the illustrated textbook of pediatrics, because one case covers at least two topics, 2 to 3 topics, which are given in the illustrated textbook or in the SOP. So they are very good books. Even if you read those books with very good understanding, it is very difficult to understand those books because it is very concise, or they have written very concise details on which even I can say that for one clinical case book, you may spend 2 to 3 hours just in reading one time, because they are that much concise and that much good.
तो
But
फिर ये
once
क्या
you
करके
understand
रखी?
those books, it will be very easy for you. So I can advise you, if you are aiming for the June exam and currently you are preparing for the MCPS exam, then you can go for the clinical cases. You can start with the clinical cases book. Ma'am, regarding, okay, Tuba, I have answered your questions already. uh Jamal, I'm not doing any job, just 3 hours clinic in evening in my own hospital, so I have a lot of time, and I study in the morning. Okay, Jamal, you can start with the clinical cases book task and the FOB. And if you have so much time, then you can go for the SOP book. SOP is a very, very good book. And believe me, each and every question of the task is asked from the SOP. It is a very good book if you go in detail, and it is a very interesting book. So if you have enough time, if you have so much time, and there is not much doing, you are not that much busy, you can start with the SOP book and you will enjoy it. I can assure you. Okay. Okay, Jamal is saying SOP is quite tough. Yes, obviously it's because it's basics, and for the task you need basics. So you have to be very good grip on the basics. If you are unable to understand the SOP book, I will advise you watch YouTubes on the separate topics. Suppose if you're going for the anatomy of some system, like in neurology or cardiology or GIT, then there are many videos, short videos available on the YouTube. Just watch them one time and then read from the SOP book. It will be crystal clear for you, all these things. Thank you, Tuba. I'm missing. Thank you. You are welcome, Tuba. Thank you, and Jazakallah for the answer. You are welcome, Dr. Jamal. Shivram is asking 2 months are enough for the part one. Again, Shivram, I have already explained in all details. I don't know you. I don't know your background. I don't know how much experience you have in the pediatrics. I don't know where you stand, so I cannot tell you 2 months are enough or not. If someone has done FCPS pediatrics, suppose, or MD pediatrics, in different countries, so I can say that maybe with very hard work, 8 to 10 hours per day, you can go for the exam and you can ace this exam. But if you are a very beginner and you don't have any experience in the pediatrics, then it is very difficult. I can say that. Okay, Iram Nawaz, kindly repeat what to study before SOP book. Iram, there is nothing before SOP. Each and everything is SOP. SOP, I will explain again that SOP is for the tasks basically. SOP along with clinical cases book of the task. These two books you have to read for the task, and illustrated textbook of pediatrics, clinical cases book of the FOP, and the guidelines, nice guidelines. These three things are necessary for the FOP exam. So if you are starting with because TAS is basics, FOP is clinical. These are two different things. If you are going to attempt those papers in one day, then You have to read all these books, I will say that. But if you are planning tasks separately and FOB separately, then you have to categorize them. Tasks for the task, clinical cases book for the task, and the SOP, because SOP, each and every basic is written down in detail. You may not need the SOP for the FOB. For FOB, you need clinical book, and that is illustrated textbook of pediatrics. Completed master, Shivram is saying that he has completed masters. How much hours per day to crack FAB part 1? Okay, if you have completed the masters in pediatrics, then with the almost I can say that October, November, December, January, there are I think 4 months. Okay, with even 5 hours, 4 to 5 hours, 5 to 6 hours, I can say that even with 5 to 6 hours per day are enough for the FAB. You can crack exam for the FOB attempt, but the basic is that you have to make a clear understanding of what is task about, what is FOB about, and the topics, because in us or the like FCPS, these are different things. They are totally, so we don't have our basics good, because we have read those basic anatomy, physiology, pharmacology in microbiology in third year, fourth year. So we have I think almost forgot each and everything. So you have to make a very good understanding. It's up to you how you can make that, and you are good to go. Okay, I think that today, if there are any more questions to ask, if no questions left, then we can finish this session. Okay, I think there are no more questions. Thank you so much once again to all the participants for joining this webinar. Uh, Thank you so much.